coming to the poisons, when someone takes the poison, inhales the poison, something, normally people tend to give water dissolved with salt so that they will vomit. These type of things people do. So what's your opinion on what to do when someone takes poison?
Sir, it all same like drowning, you know. So you're trying to remove everything from the stomach is what you are trying to do, okay, by giving vomitus, by initiating vomit. Bad, again bad. So patient doesn't die immediately because of the poison, but he will die because of the aspiration if he aspirates into the lungs.
Right.
So always avoid making them vomit. No, it's absolutely no. Don't let them vomit as such. If they vomit on their own, yes, again recovery position and then making them bending forward and making them stay in that particular position until the whole thing comes out. That is the only thing you can do. Okay. Again, if it is a chemical, it's not only goes into the stomach but it falls on the body also. If you really want to help the patient, clean him, change the dress, clean him first. That will stop 50% of the transmission of the poison into the body. Okay. And within 1 hour, that's called golden hour. If you come in that particular hour to the hospital, we have a small tube for few poisons only. You are supposed to do this and put a small Ryle's tube into the nose and then try to clean the stomach. We call it a stomach wash in a controlled environment because we know what we are doing. The patient will not aspirate when we do that. Okay. So in that particular scenario, only we recommend a stomach wash, but otherwise no, it's an absolute. And there are some acids and alkalis, caustic materials where you are not supposed to put Ryle's tube. You know, it does more damage than benefit. And if it is something like evaporate, like, you know, kerosene, it evaporates, petrol evaporates. So when these are evaporate substances, it's not the fluid in the stomach itself which will kill you, but the vapor which causes your lungs to breathe and it causes damage in the lungs. So that will kill you more than this one. So avoid, if you in this kind of vaporized materials, if you are there, you wear a mask and approach the patient. It's always better if going to patient 1 minute later than going unprotected by yourself. So, and then absolute no for a vomiting, and then within 1 hour if you can reach to the hospital, they will know which kind of medicine it is. Always carry the bottle or whatever the item which the person has ingested, so that we have some antidotes available. They can give immediately to that particular patient in whatever the way it is required, and they'll definitely require an absolute professional way of helping for poisonings, not just a lay kind of thing, sir. It will definitely harm the patient than benefit.
Thank you, sir.